Good morning. I'd like to call this roundtable to order. Today is Monday, June 2nd, 2025. The time is 9 a.m. We are in room 412 of the John A. Wilson Building. We're also online on the Zoom internet platform. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today we will hear from three nominees to the Board of Rehabilitative Therapies. Directly following this hearing, we'll hold the FY26 Budget Oversight Hearing Part 2 for the Department of Behavioral Health. The Board of Rehabilitative Therapies was created by DC Law 25-191, the Health Occupation Revision General Amendment Act of 2024, and includes three scopes of the three boards that was sunset by that law: the Board of Physical Therapy, the Board of Occupational Therapy, and the Board of Audiology and Speech Language Pathology. Those boards will cease to operate upon the creation of the Board of Rehabilitative Therapies, which will start July 19th, 2025, or when a majority of the seats are filled, whichever comes first. The Board of Rehabilitative Therapies is comprised of 11 members appointed by the mayor, 3 physical therapists or physical therapist assistants licensed in the district, 2 occupational therapists or occupational therapist assistants licensed in the district, 2 audiologists or speech language pathologists licensed in the district, 1 recreational therapist licensed in the district, 2 consumer members, and 1 of which shall be a district licensed or registered. Audiologist, audiology assistant, physical therapist assistant, occupational therapist, occupational therapy assistant, recreational therapist, a speech language pathologist, or a speech language pathology assistant. Of the members initially appointed, 3 are appointed for a full term. 4 shall be appointed for a term of 2 years, and 4 shall be appointed for a term of 3 years. The terms of the members first appointed shall begin on the date that the majority of them first members are sworn in, which shall become the anniversary of the subsequent appointments. Now to the nominees. PR 26-193 nominates Bernadine Evans to the board as a physical therapist licensed in the district for a term to serve 2 years. Dr. Evans is a clinical assistant professor of radiation therapy at Howard University and holds a doctorate in physical therapy from Syracuse University. She previously directed restorative and rehabilitative services at Ashbury Methodist Village, overseeing 2,000 resident community and a 250-bed rehab facility. She serves on the editorial board of the Journal of Orthopedic Research and Psychotherapy, and is a member of the American Physical Therapy Association and the DC chapter of American Geriatric Society. Dr. Evans is a Ward 4 resident. PR 26-194 nominates Dr. Angela Grice to the board as a speech language pathologist licensed in the district for a term to serve 3 years. Dr. Grice is the owner of the Dialogue Group and an adjunct clinical professor at Howard University. She earned her master's and doctorate degrees in speech language pathology from Howard, and her clinical and research focus includes traumatic brain injury, executive functioning, and service delivery among culturally linguistic diverse populations. She has extensive experience providing speech language services to schools, clinical, rehabilitative settings, and has taught and conducted research at institutions including Columbia and Howard. Dr. Grice is also a Ward 4 resident. PR 26-199 nominates Dr. Jillian Ray to the board as an occupational therapist licensed in the district for a term to serve 2 years. Dr. Ray is the founder of Sublime Kids, LLC, and is part-time faculty at the George Washington University Milken School of Public Health. She brings over 22 years of clinical and academic experience in occupational therapy. Her work spans pediatric, adult, and interdisciplinary collaboration in underserved communities. Dr. Ray's research interest includes occupational justice, the impact of adversity on child development, and family-centered care. She holds a doctorate in occupational therapy from Temple University, and Dr. Ray resides in Ward 3. Okay, so I will bring up all 3 of the nominees. So Dr. Ray is virtual. So if you could turn your camera on when you join us.
Yes. I will.
And Dr. Evans, if you could join us at the table. And I will swear you both in. Dr. Grice is running behind. All right. Okay, just 1 second. Dr. Ray, you just need to turn your camera on. There you are. All right. Okay, if you both can raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Okay, great. Okay, have a seat. And Dr. Evans, you can go first when you're ready. Good morning. You just got to hit the button in front of you to turn your mic on. There you go.
Gotta switch my eyes. Give me a second. All right. Good morning, Chairperson Henderson and members of the Committee on Health. My name is Bernadine Evans, and I appreciate the opportunity to testify today regarding my confirmation as a member of the Board of Rehabilitative Therapies. I would also like to thank Mayor Bowser for nominating me to serve on this board. I am a native Washingtonian and have been a licensing practicing physical therapist since 1986, with 35 of those years being licensed in the District of Columbia. My career has led me through physical therapy practice in multiple genres, including acute care, outpatient, home health, sports medicine, acute rehab, geriatrics, neurology, oncology, orthopedics, and wound care. In addition to my clinical experience, I have administrative experience directing and supervising rehabilitative services in the continuing care retirement communities, assisted living, and long-term care. My staff have consisted of all disciplines in rehab, including the therapist, physical, OT, and speech, as well as the assistants. There have also been rehabilitative nurses and licensed practical nurses on my staff. At present, I am the supervising physical therapist at a freestanding pro bono clinic in Northeast DC. I am also on the board for this pro bono clinic. My experience as an educator began as an adjunct 19 years ago, teaching neurology to physical therapist assistants at a community college. I obtained my doctorate degree in 2012 and began teaching full-time faculty within Howard University's physical therapy program. Becoming program director of physical therapy, I continued to teach and supervise research both within my profession and other disciplines, including occupational therapy, physician assistant, radiation therapy, and clinical lab sciences. I am a full-time faculty at present, teaching oncology and pathology within the Department of Radiation Therapy. My courses have been taught interdisciplinary, including professions of nursing, pharmacology, and medicine. And I have been awarded Professor of the Year and Provost Excellence in Service Awards twice while at Howard University. And I continue to serve on multiple committees at Howard University. Practicing in a manner that involves an interdisciplinary approach has made me uniquely able to empathize and understand healthcare professions beyond my own. Presiding over student grievances and being an advisor to the deans of our college has given me experience in interpreting policy and implementing regulation. Nationally, I am a member of the American Physical Therapy Association and have been so for 39 years. I have been a continuous member of the sections of neurology, geriatrics, research, education, policy, and oncology, and am currently a board certified specialist in geriatrics. I am also on the board for the Federation of State Boards of Physical Therapy and have been a member of the Compliance Committee and Education and Outreach Committee for the Physical Therapy Compact. My career experience has provided me with a well-rounded background, which is essential to understanding the complexities of my current role as chair of the Board of Physical Therapy. As chair, I have conducted both open session and executive session meetings for several years, understanding the legislative processes of the district and adjudication of licensure and complaints to the board. During my term of office, the board has consistently maintained over 1,000 licensed PTs and over 80 PTAs. In addition, the PT Compact legislation was approved and the board began issuing compact privileges. This process was groundbreaking in that the boards of medicine and physical therapy are the first healthcare boards within the District of Columbia to have compact privileges. The PT board members maintain quorum to participate in monthly meetings despite the pandemic and its repercussions on the workforce. The PT board promoted bringing the language towards physical therapist assistants current and the provision of care by the PTA to that of general supervision. This language improved access to physical therapy within the district. The PT Compact has improved access to physical therapy within the district. Moving forward, my hope is for the Board of Rehabilitative Therapy to update the PT Practice Act and to work with the subcommittee that has already been approved by the Board of Physical Therapy to make this document current. The Board of Rehabilitative Therapies must also continue to work addressing the impact of telehealth and AI on the professions of physical therapy as well as the other rehabilitative professions. There is work to be done to make sure that all residents of the district have access to quality, effective, and current rehabilitation. I strongly believe in public service, protecting the community, and providing excellence to the citizens of the District of Columbia. For these reasons, it is my strong desire to continue serving the District of Columbia as a member of the Board of Rehabilitative Therapies. Thank you for your time and consideration. I would be happy to answer any questions you have.
Thank you so much, Dr. Evans. Dr. Ray?
Good morning, Chairperson Henderson and members of the committee. I am Dr. Jillian Ray. I also go by Gigi. It's my pleasure to receive your consideration for my nomination to serve on the Board of Rehabilitative Therapies. I am grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve, to continue to serve the residents of our district. I hold a doctorate in occupational therapy with a specialization in pediatrics from Temple, a master's in special education from Virginia Tech, and a bachelor's in occupational therapy with a psychology honors from the University of KwaZulu-Natal, South Africa, my birthplace. My professional journey began in South Africa, and I am currently licensed to practice in Washington, D.C., New York, Virginia, Pennsylvania, and Maryland. My experience spans multiple sectors. Clinical practice, I've worked across pediatric, adult, and geriatric populations in both urban and rural settings, addressing developmental disabilities, neurological and genetic conditions, as well as promoting occupational justice for underserved communities. In the area of academic leadership, I've directed and taught in master's, excuse me, and doctoral level occupational therapy programs at several institutions such as the George Washington University, NYU, New York City, Temple University, with a focus on curriculum development, accreditation, and research, as well as mentorship of future practitioners. In the area of entrepreneurship and community engagement, as a founder of Sublime Living, I have led initiatives that bridge health and education, primarily focusing on equitable, holistic, strength-based approaches to empower individuals and families. In the area of board and regulatory experience, I currently serve as the chair of the DC Health Regulation and Licensing Board of Occupational Therapy, where I've overseen licensure, policy development, professional standards for the district for the past 7 years, including as board chair and member. My commitment to the Board of Rehabilitative Therapies is grounded in a passion for advancing equitable, evidence-based, and person-centered care. I have a proven record of advocacy for diversity, equity, inclusion. My work emphasizes occupational justice, cultural competency, and addressing health disparities, particularly for marginalized and multicultural communities. In the area of policy and program development, I have experience developing inclusive policies and programs that empower children, families, practitioners, and I've delivered technical assistance to educators and administrators from early intervention through transition to adulthood. leadership and collaboration. I've successfully built partnerships with universities, nonprofits, and community organizations. I've worked both in private sector and in with various NGOs, including the World Bank Family Network, the American Psychological Association. I am committed to fostering collaboration amongst all stakeholders in rehabilitative care. As a nominated board member, I'm dedicated to upholding the highest standards of professional practice and ethics, promoting innovation in rehabilitative therapies through research, education, and interprofessional collaboration, ensuring that the voices of practitioners, clients, and families are represented in policy and decision-making, and supporting the ongoing development of a diverse and competent workforce to meet the evolving needs of the district. I thank you for the opportunity to continue serving the people of the District of Columbia. I look forward to contributing my experience and my vision to the Board of Rehabilitative Therapies as we work together to advance the health and well-being of our community. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and members of the committee.
Thank you. And we've been joined by Dr. Angela Grice. Dr. Grice, if you want to. Good morning. All right. Wonderful. When you're ready.
Oh, I'm ready? Okay. Good morning, Chairperson Henderson and members of the Committee on Health. My name is Angela Marie Grice, and I appreciate the opportunity to testify today regarding my confirmation as board member of the Board of Rehabilitative Therapies. I would also like to thank the mayor for renominating me to the board. I've been a licensed speech-language pathologist since 2003, with 15 of those years spent practicing in the District of Columbia. Over the course of my career, I have gained valuable experience in academia, healthcare, education, and private practice. I've been serving on the Board of Audiology and Speech-Language Pathology since October 2016. My career experience has equipped me with a robust background that is vital for understanding the complexities of the board member role for the Board of Rehabilitative Therapies. I have a deep commitment to public service, a passion for safeguarding our community, and a dedication to upholding excellence in my profession. For these reasons, I am eager to continue serving as a board member and to contribute to our shared mission. As a board member and acting chair, I have facilitated meetings for several years and have developed a strong understanding of the legislative processes within the district, as well as the adjudication of licensure and complaints presented to the board. Our board members are deeply committed to our mission statement, which states, the DC Board of Audiology and Speech-Language Pathology regulates the practice of audiology and speech-language pathology. The board advises the mayor and administers and enforces the law. The board also evaluates applicants' qualifications, administers exams, recommends standards and procedures, issues licenses, receives and reviews complaints, requests investigations, conducts hearings, and issues subpoenas. The board has an essential role in safeguarding the practice of audiology and speech-language pathology. It is imperative that the board remain transparent and invite the public to invite their participation in open sessions. The board will also work to implement the issuance of licenses. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and members of the committee.
Thank you. And thank you to the witnesses for testifying, but also thank you so much for your willingness to serve. You know, when we're learning or trying to communicate to the public about, number one, the importance of all of our boards in the health occupations, but also when I explain to folks, like, number one, it's a lot of hours, and number two, y'all don't get paid. But we thank you, and we ask anyone who is interested in serving to please visit the Mayor's Office of Talent and Appointments. No, but also seriously, I recognize how complicated it can sometimes be to merge boards together. And all three of you are coming from different professions to now have to make this new thing work. And I also feel like when we're starting something new, whoever those first board members are truly set the tone for how the collaborative work is going to go forward. Dr. Ray, you talked a lot about collaboration in your testimony. And I feel like in this particular case, when you have OT, PT, and speech language pathology coming together, you're really going to have to lean on one another in terms of the expertise to, as you're evaluating particular disciplinary cases or otherwise that might come before the board, to determine, you know, is this real? You know, talk a little bit about how you all plan. I guess it's hard to sort of ask that question. How do you plan to approach those collaborative pieces? But I'm imagining you've all had to think about that just a little bit. So I want to give an
Yeah.
opportunity to sort of
Yeah.
speak to that. Dr. Ray, if you want to start.
Sure. I mean, I would say, I mean, I think, you know, I think when there's change, people's initial reaction sometimes is like, yes, we like change, but we don't want to be changed. So there's like a subtle but important difference. And I think even when this came to the Board of OT, you know, everybody was worried about, you know, well, are we going to be well represented? We work different from PT, we work different from speech, but honestly, I think it's a good thing. We work together in practice. We work together at the bedside. You know, we work together in academia. And I think, you know, it's going to go a long way to decreasing this kind of, we don't even sometimes know what each other does, right? So I really think that we're mirroring what happens in practice as a board. We're mirroring what happens in reality, that, you know, a patient won't see an OT, but sorry, my dog. They're also gonna have the experience of that interdisciplinary team. And I really think that as a board, we're really showing what the reality is. And I think that's a really good thing, because we're gonna learn more about not just what each other does, but also from a legislative point of view. You know, and coming together as one. So I'm very happy about it. I know that there might have been some people who weren't, but I think it's a good thing.
Okay. Dr. Evans, Dr. Grice, I don't know if either of you want to add anything.
I was just going to say, similarly, I'm used to working with OTs and PTs, and I think that we're stronger when we build a community. We're together instead of like being off in silos. And so I'm excited about it, and I think that we are all very capable and we'll do well.
You just turn your mic back on, Dr. Evans.
Yeah, thanks for reminding me. So when I first heard about the combined boards, I think I had the same concern as was expressed here, as the voices of assistants. We all have assistants in our profession, and it has been a journey getting their voice heard on the individual boards. And I wanted their voice maintained on the combined board.
Mhm.
And the way that they have pulled the quantity of the therapies together, I think that speaks to the desire to maintain the voices for all professions. And we do work with the same patients in the same settings, and we work in different ways. The other concern I had was our constituents, being aware of the different disciplines and who we are. And I have been excited hearing the testimony of not just the the board potential candidates here, but just reading them on the docket, because it speaks to the commitment of the members that are going to be on this board. And you're right, the first members of a board they set the tone. They set the tone. And that was one of the reasons that I was very excited to be granted the opportunity to be a part of this first year, this first coming together of the board, because I think it's going to be, with the people we have on it, I think it's going to be groundbreaking in the district. And I love change. I love changing all the time, but I'm also the person that asks a lot of questions when there is change, so that everybody's voice gets considered in the change. And I was one of those people in that 10-hour call that you did and handled beautifully. I was on a town hall with the chair, Mendelson, and it just gave my heart pride in the district, because you asked the questions that needed to be asked moving forward, and Mendelson considered all of the things. And I think that's what we owe our constituents when we make changes and decisions, not just for our comfort or the comfort of our administration, but for those people who are the public who we are here to protect. And I'm very confident that everybody on this board that I've seen has that same commitment. So I think this is going to be a wonderful process.
Good. I'm glad to hear that. It's always a little nervous for us when, DC Health was proposing to merge, and I was like, I don't know. And we definitely, when we were hearing testimony on the Health Occupation Revision Act, there were definitely some professions who were like, no, we can't be with that. So, at least you all are working together. Okay. I want to ask a couple of other questions. So Dr. Evans, on the PT board, you guys have already moved forward with a compact.
Yes.
Now I know your friends in
OT.
Your friends in the work OT, they also want to OT, or they would like a compact as well. I'm sure speech probably wants one too, because everybody feels like a compact is, the thing to do. First, let me not make any assumptions. Dr. Ray, let me ask you, what are your thoughts in terms of an OT compact? And then I'll go from there.
I'm in full support and agreement, and it's why it's at legislature right now, because as a board, we all are in support of it. I've been practicing for 30 years, a little bit over 30 years, and in the US, I've spent the majority of my practice, having to apply every time you go to a state or work in a different, it's not just costly, but it takes a lot of time, a lot of effort. It takes a lot of, human hours. And you think about all the work that has to be done behind the scenes to grant somebody a license. I think it's also going to help with providing care more effectively, more efficiently. And it's, having one central place that can vet, can review, can look at, backgrounds and all of that. I think, it really streamlines the process. So, we're all definitely in support at the Board of OT, and why we've moved it up to become official. It's really going to help the practice, and not just of OT, but everybody else is doing, PT, speech. I think it's a good thing. In many reasons I can go on about it, but
Yes.
I think it's a good thing. Yeah.
Now, it hasn't been reintroduced here this year, but nonetheless, I do feel like this is an opportunity to share some experiences, pitfalls, perhaps challenges, and sort of standing this up. Dr. Evans spoke about in her testimony some of the things that you hope to do going forward. I think you talked a little bit about updating the PT practice. Dr. Grice, Dr. Ray, I'll give you the opportunity as well. Are there some specific things that you're hoping to be able to work on in this next chapter on this new board?
I definitely would love to work to increase like the awareness of the professions within not just the community, but also we talked a lot about extending this to students to start to have them be aware so that then we can kind of get them on the path to entering these professions because we desperately need. I know that in my practice, we're always looking for SLPs, we're always looking for OTs, PTs. You know, we sometimes, but I think you guys you have larger numbers.
Yes.
But the OT and the speech is just, suffering right now. So I think introducing that into other populations, like I said, on a high school, middle school level, I think would be amazing to get people increasingly aware of what we do. Because often, I mean, it's a great job, but I don't think many people always know about it. It's not thought about, right? And so I think that's one of the things that I'm really passionate about.
Yeah, it's usually not thought about until you need it or someone in your family needs it.
Exactly.
Dr. Ray?
Yeah, I couldn't agree more with that. I'm so glad that you also feel that way about bringing, more community. I think that sometimes as a board, we get focused on legislature, we get focused on licensing and the things that go with licensing and all of the regulations. But I think we could definitely do better with community. As a board, how can we engage the community more? At a high school level, but also I think it also starts earlier than high school, just thinking about school age children in general, how can we engage with them, but how can we engage the community more broadly? How can we get more involved in events that are happening in the district? As board members, I mean, we're here to support and take care of the consumers of the people of the district, but how can we really engage them? So not just schools, but also organizations, then, also at the academic, at the university levels. One of my thoughts is even, how do we get interns? I know with the board, open sessions, we're always, it's open to anybody in the public, but you don't always have the public coming to those meetings. How can we get more of the public involved in those open sessions, being present, and having a say at the table in what happens, so thinking about what are some things we can do to get more public members showing up to those board meetings. So that they can feel like they're more involved with what happens in the district as far as our professions go in healthcare. And then, how can we get more interns involved in the board and the work of the board as well?
Okay. All three of you have not only clinical experience, but experience in the academic setting. So obviously it's good to hear in terms of thinking about the pipeline of what's happening on that front. But Dr. Evans, I'm curious, how have you integrated your academic research with practical care, particularly for aging populations?
Oh, that's a big question because we do so much in academia and without thinking. It's not only required of us, but we do it because it's our students are passionate about it and they pull us in that direction. So for me, I have maintained a relationship with the Department of Aging in the district and have done published and done research out of those 8. Now we have 8 in each ward. When I first started doing this, we did not have a dedicated senior center in every ward.
No.
So
We still don't.
there's
but
one,
there's one.
there's one, but
They feel very strongly.
Yes. So I work in every one of those. I make sure that our university is connected, not just with the ones close to Howard University, but the ones that are in 7, 8, 3 everywhere. And have been on interdisciplinary committees where we were on a falls committee for several years. And I love that committee because it brought together not only the medical disciplines, but I'm going to say the businesses, the public works offices, and we all talked about how to prevent falls in the district. And we had annual activities on Falls Prevention Day for that. So for seniors, to me, it's about reaching out to the churches. The churches are really strong in the district for reaching out to seniors. I am the person that if because I run a pro bono clinic, that's through Catholic Charities, they will call me if there's someone who needs an advocate, and I will go in. I've been in emergency rooms with my patients because when they went before, they weren't understood. And trying to help even in children's hospital. And I say I'm a geriatric therapist, not a pediatric, but I've been in children's hospital because if you said you work in traumatic brain injury as well, to advocate. And that to me it's not just working with planned organizations, it's every day. It's being available. And my thing is coffee and conversation works. I will meet at a Busboys and Poets in a heartbeat and just sit and chat with the constituent and say, okay, what is it about your care in the district? What if you had a magic wand? How would you change it? How was your care? You just recently had it. What do you feel like you need? So it is ongoing. And then I take that and I have to teach it to students who may have never encountered someone older than a certain age in their life, maybe a grandparent at some point. And you have to work with them. So I've gone to conferences and taught sessions on working with older adults in understanding ageism and how we come marginalize or minimalize an older adult. So that I'm very passionate about in the district.
Okay. Dr. Grice, I mean, your clinical focus has been on executive functioning and traumatic brain injury. How do you sort of marry the two with practical care?
So I have a deeply personal commitment to the aging population. I've been a caregiver for my parents. They've passed now recently in December, but I've been a caregiver for 14 years. And so for that, right, the aging population is really important to me, and the care of them, and then the care of the caregivers. So that's something that has kind of arose out of my personal connection to it, and knowing how difficult and challenging it can be to find resources. And I had them age in homes. So there were so many services that were needed. In terms of my research though, and how I have kind of brought that all in, because I think that it almost felt at some point in my life that because I had a concentration in neurological disorders, when I initially started, that I experienced all of them with my parents. And so I had Lewy body dementia, Alzheimer's, traumatic brain injury, stroke. So my parents had all of those things over the years that I cared for them. And so I know how important it is to be able to provide those resources in terms of teaching my students, because I'm also a professor at Howard. I mainly teach private practice, but what I've been able to do is kind of encourage them in the practices that they want to form. And so I've planted the seeds for them to start to think about what kinds of things, not even just traditional therapy and practices, but even other things that create products and things. One of my students was into creating apps and using the phones that everyone has so readily now to kind of manage memory and time management and all those executive functions that kind of go away when you have either a traumatic brain injury and or a stroke. And so just really encouraging them and being able to kind of spread the research and the evidence-based kind of practice that's used within those practices and those communities.
Okay. Dr. Ray, similarly, you have both clinical and academic experience, but your career has also spanned multiple countries in terms of your work. So thinking about sort of your international experience, how has that sort of shaped your views in terms of marrying the two between academic and clinical practice?
I'm gonna try to be brief. I think, not just as an occupational therapist, but I think also as a person. I was born, raised, brought up in apartheid South Africa. So I always say I feel like I have been fighting the good fight from the day I was born, in terms of racial inclusivity, equity, health equity, and justice. And I think my work around the world, that's always been at the forefront, is understanding cultures, understanding ethnicities. I think as an occupational therapist, we directly work with people's lives in the sense of, helping them, assisting them, supporting them to be more independent. And so when we do this work and we claim to be client focused and client centered, we truly need to understand where and who that client is and the environment they live in, how the environment impacts them, how that environment influences them. And I think, obviously, you don't need to travel all around the world to understand that factor of the environment. But just here in our district, we see it every day, all day, on how the environment impacts and influences people differently. I've worked a lot. I spent a lot of time in Ward 7 and 8. I work with the Rodham Institute, which is now based in Georgetown, and they champion health equity. All of their programs are about community outreach. And so I think my work in different cultures and communities around the world, in my own country, in South Africa, and here in the district, has really equipped me to appreciate how environment really matters and how it can make a difference and how it can also be a barrier to people needing what they need to be successful. Everybody needs access to resources and opportunities, no matter, what you look like, but some people don't. As we know, and that impacts how they live their lives from very young ages through adulthood. So this is what I'm really, really passionate about, from academic to clinical practice. I just had an opportunity to contribute as an author to a book that was published earlier this year on how to incorporate equity and justice in your teaching, primarily at a university level. But this took a lot of that experience of mine, and I was able to, finally get to write about it. And I got a seat and an opportunity with some amazing authors to write about something that is very near and dear to my heart. I also just it's about to be published, but one of the pediatric textbooks that our students use, not just here in the US, but abroad. It's one of our texts. It's now in its 6th edition. But the chapter that I worked on was initially that it asked, about weight management and children. And of course, I could not write a book about weight management and children without adding equity and justice. It's not just about what you put in your mouth equals, how much you're going to weigh, but what resources do these children have access to, right? Can we still be applying BMI? No. So, really got into debunking the BMI, because this was not developed for everybody. We shouldn't be using it to measure everybody.
Dr. Ray, they're going to mess around and call your textbook woke.
Well, I was like, their goodness, it's
Your
about
textbook banned before it even gets
it's about to be published. Like we're literally at the final part of like just making sure all of our information is correct. So I'm like, oh my goodness. And it's Elsevier, which is a non-US publishing house, but hopefully we're not going to have any so it is very woke.
I'm joking with you. I am.
No,
I think it's
it is super woke in the sense that I love when they said, would you want to write about weight? Well, they called it obesity and childhood. And I said, what? We're not calling it obesity, first of all. That's diminishing. So we need to change that language. And so it was just really a way to shake things up. Previous editions looked at obesity in children, and it was like, okay, wait a minute. There's a lot of things that factor into what we put in our mouths, or don't. Resources, trauma, there's, food deserts, food swamps, and the list goes on. But it always comes back to equity, right?
Yeah. Yeah, no, you're correct. And this is actually giving me such, I feel, number one, very proud that all of you have you're weaving it into your work. It's not an extra, it just is part of the fabric of what you're thinking about in terms of how communities have access, how communities have been diminished in the past, particularly in the health space, and how you can, in small ways, right? This is a chapter, but how can you change that going forward? Well, thank you all so much. I have one last question, which I ask everyone, is that I'm sure, well, you all have previously served on boards, so I need to hear it affirmatively that you have the dedicated time to actively serve the time that is required. So everybody has to, you don't have to say yes, but you got to give
Information.
some response. Dr. Evans.
Yes. I have the time to spend on this board. Can we do this? No, sorry. I do. That was one of the first things I checked before I agreed. Yes.
Okay. Dr. Grice.
Yes, I also have the time. I'm very intentional about it, and I do have the time to serve on the board.
Okay. Dr. Ray.
Yes, I do. And I'm so excited to work along these other two fabulous people. And when I read about you guys, I was like, wow, this is amazing. As Dr. Evans said earlier, I feel like it's just, I can feel that the energy is great. And I'm excited for this new board and what we're going to do.
Great. Well, thank you guys so much. And it's not just you three. Unfortunately, there was a nominee who couldn't be here today. And then we have a few other nominees who we had just had hearings on them for their other nominations. So we didn't make them come back in. But from a timing perspective, unfortunately, because of the way that the calendar is working, we're going to miss the full count. Like, you're going to be approved before the full council actually has an opportunity to vote. That doesn't mean that you're any less, whatever, you're going to be approved, but we are going to do committee reports and file those. So we have those for the record. And we also felt that it was incredibly important as we go into having this new board that we have on the record, members who we haven't talked to come and testify in terms of, their interests and intentions in terms of serving. But this concludes today's roundtable. So I want to thank you all for being here. And again, my PSA for those who are watching at home, volunteering for a mayoral board or commission is an excellent way to give back not only to the district and its residents, but also to your own profession as you're helping to craft and inform some of the program and policy decisions therein. So the committee will hold its next hearing today in about 13 minutes. We're going to do the part 2 of the FY26 budget hearing for the Department of Behavioral Health. And we're going to hear from the government witnesses on that. The time is 9:48 a.m. and this roundtable is adjourned. Thank you so much.
Thank you.
Thank you.